COVID-19 has caused a lot of talk about vaccinations. Some believe vaccinations are vital while others believe it's skeptical. This article talks about a 2015 measles outbreak that could have been avoided with vaccinations. This message is alarming during a corona epidemic. If we have a vaccine to stop an outbreak, why not take it? Despite the fact that measles has been all but eradicated in the United States since 2000 because of vaccinations, it has made a disturbing comeback in recent years, owed in part of people obtaining personal belief exemptions from rules that say children must get their shots to enroll in public school. To be sure, parents have become concerned about vaccinations for all kinds of reasons. Some view their pediatrician as a shill for the pharmaceutical companies. Some believe the vaccine will actually give their child the disease the shot is meant to prevent. Some say that if everyone else is vaccinated, their child will be protected. But the one health official claim that has done the most damage is a thoroughly debunked study claiming links between vaccinations and autism. Its effects are still being felt in the United States. Although most children here are given the MMR vaccine, measles, mumps, and rubella, at 12 to 15 months, a repeat vaccination is recommended at age 4 or 5 to increase resistance. Last year, the U.S. Centers of Disease Control and Prevention reported there were 644 new measles cases across 21 states, more than triple the number from previous years. This is both sad and potentially tragic. Measles is a disease that was beaten by modern medicine. Many now treat it as a benign disease that causes relatively few deaths in the U.S. That thin veil of immunity is being lifted by events originating in Disneyland in California. However, at least 95 cases in 8 states and Mexico are now somehow linked to that outbreak, according to the California Department of Public Health. Some people who are contagious visited in January as well as December. That California outbreak is also being blamed for an outbreak in Arizona. Health officials are keeping tabs on 1,000 people, including nearly 200 children, who could have been exposed at Phoenix Area Medical Center. Yes, as one of the world's biggest tour destinations, Disney was the perfect spot for the spread, with large numbers of babies too young to be vaccinated and lots of visitors from countries that do not require the measles shot. And health authorities believe that outbreak was likely triggered by a measles-stricken visitor to the park who was brought the virus from abroad. But as the Los Angeles Times said in an editorial last week, that makes it all more frustrating that anti-science stubbornness has proven the case of Disneyland-related measles that when it comes to the contagious disease, it's a small world after all. Measles is a highly contagious disease that's spread through unvaccinated people, period. The CDC noted that if one person has it, 90% of people close to that person who are not immune will become infected. As a result, more doctors are encouraging vaccination as the best way to prevent measles and its spread. And there are hopeful signs that some vaccine deniers are putting aside junk science and celebrity medical advice. A Los Angeles Times data analysis last week showed that for the first time in 12 years, the number of California parents who cited personal beliefs in refusing to vaccinate their kindergartners dropped in 2014. We hope it catches on elsewhere. It's foolish to allow a resurgence of a sometimes deadly disease that we have known how to prevent for decades.